as practice kind of work through what they can do to maximize revenue, to make sure they're billing for everything that they can, what are like the top 3 metrics or KPIs that every practice should be looking at every single whatever cadence? Like every month you should know off the top of your head, like X, Y, and Z. What are those 3 things?
Yeah, so, I think it varies practice by practice, but the top KPI for me is always that first pass pay rate, making sure you have a clean claim going out the door, not delaying that payment. We want to take a look at your collections, your percentage of collections against charges. And we also want to take a look at the percentage of your AR. We don't want your AR more than 1.5 times your charges or less. But it depends again on the specialty or the payer mix. So, having the, VA claims or work comp as part of we have a lot of pain management practices where work comp may be part of that equation. They can take a long time to pay. Auto claims can take a long time to pay. And again, specialty by specialty, we want to take a look at that. Balance against MGMA. We meet or beat MGMA standards each and every time. So our collection rates are, we're at 99.7% of the collection rate right now against charges. So we touch every claim, we document everything we touch. Those would be my top. But as far as, in-house taking a look at a practice and making sure that there's processes and efficiencies, that's a little bit different. And I would have practices ensure that they're handling eligibility as their priority, making sure that the patient is eligible for the insurance at the time, and not to confuse that with a prior authorization. Just because the patient's they've run the automated eligibility through their system, does not mean that the service itself is covered. And there may be a service that requires prior authorization. So having that in place, initially and before the claim goes out the door, saves a lot of headache on the back end trying to chase that money afterward.